So when you're deciding which type or what the parameters should be for your ultrasound machine, there are several things you need to take into account. Ultimately, you want the treatment session to be between 5 to 10 minutes, and the area should be about 2 times the side of the ultrasound head. So if you're treating something like if your patient doesn't have the proper range of motion that you want to increase their range of motion and soft tissue extensibility, you're going to use the thermal technique. And so you're going to choose the continuous or 100% option for the duty cycle. And then next you have to decide the depth of the tissue. So 3 megahertz is going to go about 1 to 2 centimeters deep. 1 megahertz is going to go 3 to 5 centimeters deep. So you have to decide if you're treating bone, joint capsules, muscles, stuff like that's probably going to be 1 megahertz. And then blood vessels, skin, fat, it's going to be the 3 megahertz. And it all depends on where you actually are in the body. Sometimes blood vessels may be deeper, and sometimes they may be more superficial. So you have to really decide for yourself what is actually superficial and deep in the area that you're treating. So then after that, you have to choose the intensity that you want to use, and ultimately it's going to be equation. You're going to be multiplying or it's an equation between the intensity, duration, and frequency, and it's got to come out to about 5 to 10 minutes. So when you're using 3 megahertz, you have to use a lower intensity. When you're using 1 megahertz, you have to use a higher intensity to get to that magic number. And then if you want to use the non-thermal effects, so getting mast cells and macrophages in the area, and then getting protein synthesizing cells in the area, that's going to be the effects of the non-thermal. And when you actually choose to use non-thermal, you're going to do pulsed, and the duty cycle is going to be 20%. And again, you have to choose the tissue depth and decide the frequency. So again, 1 to 2 centimeters is going to be 3 megahertz. 3 to 5 centimeters in depth is going to be 1 megahertz. So then you're going to make that decision, and then it's going to be the same thing with the intensity. You're going to use a higher intensity for the 1 megahertz and a lower intensity for the 3 megahertz. And then you're going to again get to the 5 to 10 minutes and the same area, which is 2 times the size of the head of the transducer.